Understanding erythroblastosis fetalis, a mismatch in blood types. This condition is a significant concern in prenatal care and requires careful monitoring. Erythroblastosis fetalis is a blood disorder that can affect babies during pregnancy and after birth. It can lead to severe complications if not addressed promptly. It's also known as hemolytic disease of the newborn, or HDN. This condition can cause significant health issues for the newborn, including anemia and jaundice. This condition arises from a mismatch between the blood types of the mother and the developing baby. Understanding blood types is crucial in preventing and managing this disorder. Specifically, it involves the Rh factor, a protein found on the surface of red blood cells. The presence or absence of this protein determines whether someone is Rh positive or Ra negative. People are either Rh positive or Rh negative. This distinction is vital in understanding how erythroblastosis fetalis develops. If a woman is Rh negative and her baby is Rh positive, it can lead to complications. This Rh incompatibility triggers the mother's immune response. This is because the mother's immune system recognizes the Rh positive blood cells from the baby as foreign. The immune system then reacts to protect the mother. It then produces antibodies to attack these cells. This immune response can be harmful to the developing baby, leading to erythroblastosis fetalis. Erythroblastosis fetalis is a serious condition. It requires immediate medical attention to prevent severe health issues for the newborn. However, with proper medical care, it can be effectively managed and, in many cases, prevented. Early detection and intervention are key to successful outcomes. Understanding the causes, symptoms, and treatment options is crucial for ensuring the health of both mother and baby. Education and awareness can make a significant difference in managing this condition. Rh, incompatibility, when mum's immune system targets baby. This condition can be quite concerning for expecting mothers and requires careful monitoring. During pregnancy, small amounts of the baby's blood can enter the mother's bloodstream. This usually happens through the placenta, which is the organ that connects the developing baby to the mother. This is a normal occurrence, particularly during labor and delivery. The mixing of blood can also happen during certain medical procedures or if there is trauma to the abdomen. However, in the case of Rh incompatibility, the mother's Rh negative immune system treats the baby's Rh positive blood cells as invaders. This immune response can be quite aggressive. This triggers the production of antibodies. These antibodies are specifically designed to target and neutralize what the body perceives as foreign threats. Antibodies are proteins that target and destroy foreign substances in the body. They play a crucial role in the immune system's defense mechanism. In this case, the antibodies are directed against the Rh factor on the baby's red blood cells. This can lead to the destruction of these cells, causing complications. The initial exposure to Rh positive blood cells may not cause significant problems during the first pregnancy. This is because the immune response is still in its early stages. This is because the mother's body is just beginning to produce antibodies. The immune system is essentially learning to recognize and respond to the Rh positive cells. However, these antibodies remain in the mother's system, ready to act if another Rh positive pregnancy occurs. This can pose significant risks in subsequent pregnancies, making medical intervention crucial. The antibody assault, how fetal red blood cells are destroyed. If a subsequent pregnancy involves another Rh positive baby, the mother's existing antibodies can cross the placenta. The placenta is the organ that provides nourishment and oxygen to the developing fetus. These antibodies then attack the baby's Rh positive red blood cells, causing them to break down. This process is called hemolysis. The destruction of red blood cells leads to a range of health problems for the baby, both before and after birth. The severity of these problems can vary depending on the amount of antibodies present and the baby's individual response. Health impacts of erythroblastosis fetalis, a cascade of complications. Erythroblastosis fetalis can cause a range of health problems for the developing baby, ranging from mild to severe. These complications arise from the destruction of red blood cells, which are essential for carrying oxygen throughout the body. When red blood cells are destroyed, the body tries to compensate by producing new red blood cells at an accelerated rate. However, this process is often not efficient enough to keep up with the rate of destruction. The resulting complications can affect multiple organ systems and have long-term consequences for the baby's health. Section 5. Anemia, the body's struggle for oxygen. One of the primary health impacts of erythroblastosis fetalis is anemia. Anemia occurs when there is a deficiency of red blood cells or hemoglobin in the blood. Hemoglobin is the protein in red blood cells that carries oxygen. In erythroblastosis fetalis, the destruction of red blood cells leads to a shortage of hemoglobin. This means that the baby's body has difficulty transporting enough oxygen to its tissues and organs. Symptoms of anemia can include pale skin, fatigue, rapid heartbeat, and shortness of breath. In severe cases, anemia can be life-threatening. Section 6. Hydrops fetalis, a dangerous buildup of fluid. In severe cases of erythroblastosis fetalis, a condition called hydrops fetalis can develop. Hydrops fetalis is a life-threatening condition characterized by an abnormal accumulation of fluid in two or more body cavities in the fetus or newborn. This fluid buildup can occur in the abdomen, chest, and surrounding the lungs. It is caused by the heart's inability to pump blood effectively due to the strain of anemia. Hydrops fetalis can lead to serious complications, including heart failure, breathing difficulties, and premature birth. It requires immediate medical attention. Section 7. Jaundice and organ enlargement, visible signs of trouble. Babies with erythroblastosis fetalis may also develop jaundice, which is one of the most noticeable signs of this condition. Jaundice is a yellowing of the skin and whites of the eyes, making it quite visible and concerning for parents. It is caused by a buildup of bilirubin in the blood, a substance that needs to be carefully monitored. Bilirubin is a yellow pigment that is produced during the breakdown of red blood cells, a natural process in the body. Normally, bilirubin is processed by the liver and removed from the body through bile, keeping levels in check. However, in babies with erythroblastosis fetalis, the rapid breakdown of red blood cells can overwhelm the liver's ability to process bilirubin efficiently. This leads to a buildup of bilirubin in the blood, causing jaundice, which requires medical attention to manage. In addition to jaundice, the liver and spleen may become enlarged, another visible sign of trouble. This is because these organs are working overtime to remove the destroyed red blood cells from the bloodstream, a process that can strain them significantly. Early detection and treatment are crucial to manage these symptoms and prevent further complications in affected newborns. Section 8. RhoGAM, a powerful tool for prevention. Fortunately, erythroblastosis fetalis is preventable in most cases. The key to prevention is a medication called RhoGAM, or Rh immunoglobulin. RhoGAM contains antibodies that prevent the mother's immune system from recognizing and attacking Rh-positive blood cells. RhoGAM is typically given to Rh-negative women during pregnancy and after any event that might expose them to Rh-positive blood. This includes around 28 weeks of pregnancy, within 72 hours after the birth of an Rh-positive baby, after a miscarriage or abortion, after amniocentesis or chorionic villus sampling, and after any bleeding during pregnancy. RhoGAM works by binding to any Rh-positive blood cells that may have entered the mother's bloodstream. This prevents the mother's immune system from recognizing the Rh factor and producing antibodies. Section 9. Managing erythroblastosis fetalis. From monitoring to transfusions. If erythroblastosis fetalis does occur, close monitoring and management are essential. Treatment options depend on the severity of the condition and may include fetal monitoring. Regular ultrasounds and other tests can help monitor the baby's health and check for signs of anemia or hydrops fetalis. In severe cases, blood transfusions may be given to the baby while still in the womb. This helps to replace the destroyed red blood cells and improve oxygen levels. After birth, babies with jaundice may be treated with phototherapy. This involves exposing the baby's skin to a special type of light that helps to break down bilirubin. Section 10. Post-birth care, addressing the aftermath. After birth, babies with erythroblastosis fetalis may need additional care and treatment. This may include exchange transfusions. In some cases, a special type of blood transfusion called an exchange transfusion may be necessary. This involves slowly removing the baby's blood and replacing it with donor blood. Medications may be given to help manage anemia, stimulate red blood cell production, or reduce bilirubin levels. Supportive care may include intravenous fluids, oxygen therapy, and close monitoring of vital signs. Section 11: Prognosis and the importance of early intervention. The prognosis for babies with erythroblastosis fetalis varies depending on the severity of the condition and how early it is diagnosed and treated. With early detection and appropriate medical care, most babies make a full recovery. However, severe cases can lead to long-term health problems such as cerebral palsy, hearing loss, or developmental delays. In rare cases, erythroblastosis fetalis can be fatal. Early and regular prenatal care is crucial for preventing and managing erythroblastosis fetalis. Rh-negative women should discuss their blood type with their healthcare provider and receive RhoGAM injections as recommended. Timely medical intervention can make all the difference in ensuring the best possible outcome for both mother and baby.